Okay, so I'm Billy Joe Wolf, and I'm going to be teaching you all about hospice care today. I'm going to take a moment and have you introduce yourself since we don't have a camera person today.
I'm Maureen Kelm.
I'm Paula Pauline.
Anna Loftus.
Thank you. So we're going to start out with a pre-test about hospice just to see what you guys know so far, and then we'll do a PowerPoint followed by a post-test. There's magazines right there you can write on. Thank you. And pens. So just let me know when you're done with those.
Okay. If we don't know the answer.
It's okay. It's just see what you know. Hopefully you'll learn it. Through. So I'm going to give you guys a PowerPoint to follow along with as well.
Okay. Do you want these back?
Yep. Thank you. Thank you. Okay, so we're going to learn about hospice. What are our plans? Our learning objectives for today are that you will be able to identify one qualification an individual must meet in order to be a candidate for hospice. And you'll be able to identify 3 duties of the hospice nurse. And you'll also be able to identify the most common environment in which hospice care takes place. So, just a little background about hospice. Hospice was traced back to the medieval times, and this was known as a place for the ill and weary travelers to rest. Hines Hospice states that hospice did not become widely known until Dame Cicely Saunders founded St. Christopher's House in 1967. She was working with a patient named David, and David was suffering from an inoperable cancer. She found that he was terminally ill, and just that he was able to better manage through the extra care of hospice. So hospice is a special healthcare option for patients and families who are faced with terminal illness. A multidisciplinary team of physicians, nurses, and hospice aides, social workers, bereavement counselors, and volunteers work together to address the emotional and social and spiritual needs of each patient and their families.
So hospice isn't only for cancer patients.
Correct. It's for anyone with a terminal illness, which we will cover now. So, in order to be eligible for hospice care, you have to be diagnosed with a terminal illness, and you have to have a doctor prognose you with 6 months months or less to live. So that's how someone qualifies. The question has come up a lot about if someone is expected to only live 6 months, but they live past that 6 months, so will the hospice care stop? That is not true. You can live past that 6 months, but if they continue to live, then we need to have the physician say that the outlook is still that death is prominent.
Otherwise, then what? We have to go back to the hospital?
Then we would probably try more curative options instead of, because this is more, hospice is focused on comfort.
Oh, okay.
Okay. So, where is hospice care most often provided? It's usually in a client's home. They like to do that because they're surrounded by their own personal environment. Family and friends can come and take care of them, but that is not to say that it cannot also take place in the hospital, nursing homes, assisted living facilities, which is where I work, and we have quite a few patients on hospice right now. And there are also dedicated hospice facilities. Yes?
Is hospice care expensive?
No, actually. It is covered by Medicare Part A, and most private insurances do pay for it as well. If they don't have Medicare or they don't have an insurance, usually different hospice agencies will work with families to make sure that they can have it provided. So, is hospice provided 24 hours a day care? What do you guys think?
Yes.
Yes. So, regardless of if someone's in the home or not, there's always a nurse, physician, home health aide on call for that family. So, just a little bit about the different services provided. There's nurses there that will manage pain and other symptoms. They offer emotional and spiritual support to the patient as well as the family. They'll teach the family members lots of skills to care for the loved one during this time. If there's inpatient need, then they will escort and help them to the hospital or whatever facility they decide to go into. And do you think that hospice care, the team, provides care only to the client or to the family as well? Just the client?
Yeah.
Anyone else?
I would think both if they're at the person's house.
Yep. So hospice teams, they work with the family as well as the patient. So that's that one. So who's on the hospice care team? We kind of already spoke about this, but there's physicians, nurses, home health aides, spiritual counselors or chaplains, social workers, pharmacists, volunteers. They sometimes need speech or physical therapies, and then bereavement counselors. So, a period of bereavement is after the loved one has passed. It's the time of mourning for the family. There's no set time of how long it can last. It more or less depends on how close a relationship you had with that person, and then how long you've been expecting the death.
So how long are the bereavement counselors available to the families after the client passes?
Typically, after a client passes, the hospice care team will still stay in touch with the family for up to a year, specifically the bereavement counselors. So, the hospice nurse, which is what we are all capable of doing, we maintain comfort and quality of life for these patients that are diagnosed with terminal illness. We have to be capable of compassionate communications with the patient and their family. We need to have keen observation skills and high ethical standards and knowledge of when to alert doctors. With hospice patients, we're not looking to treat them, so many things, that we would typically send someone in for, we're not going to. But we just need to be able to report those to the doctor. We need to be physically and emotionally stable ourselves so that we are able to help these families in the best way possible during their time. So then I have a short video here.
hospice nurse. Berta Olson is my patient. I spend long hours with her, checking her heart rate, administering her medication, and just making her comfortable. One night, Berta told me about a tradition in Denmark. When a person dies, she said, someone must open the window so the soul can depart. I smiled and squeezed her hand. Not tonight, Berta. Not tonight.
So pretty sweet little video, and just shows the differences that we can make in the lives of these families and patients. I'll have you guys take a post-test in a minute, but I did bring this visual aid today. As you can see, it's set up. I just made this to encompass hospice care. So there's a picture of the family, because we're not just caring for the patient, but the family as well. Books here because there might have been interest that the patients were big readers or whatnot, so then many of the hospice care team might do that with them while they're providing care. There's a bunch of supplies, medical supplies, medications. There's a cross, just to talk about the spiritual aspect. So I'll pass that around. You can take a look. And then, so the post-test is the same one we took in the beginning. Hopefully you learned something now and you'll be able to get all the answers right.
There's your doll in there.
Why a tennis
Yeah.
ball?
Well, it's just, something to do.
Yeah.
Oh.
Maybe
Like
It
a
might be,
squeeze ball.
yeah, stuck in bed, so something's better than nothing.
yeah. Oh, there's scents.
Yes.
Like smelling.
Lotion
Aroma
and
therapy.
aromatherapies, because massage and
It's
those-
helpful.
Yeah, yep. Thank you.
Yeah.
Okay. Is there any other questions?
I don't think so.
Okay, well thank you all for being here today. That is the end.